Hey, my name's Stacy and welcome back to my YouTube channel. So today I'll be talking about some tips that I have for passing med-surg. I just finished my second semester and med-surg was actually really hard. So if you want to know the 7 tips that I have for you, just stick around and keep watching. So my first tip is pay attention in class. I know that sounds like obvious, right? But like, I feel like a lot of times I go to class and I'm like listening, but I'm not even really like registering what they're saying, and I'm just like taking notes mindlessly. I really recommend that in med-surg you actually pay attention, ask questions. I would even probably come prepared. Like, I know they say like some people don't learn that way, but if you can, skim the chapters beforehand, and just so you kind of are familiar with the material so you can ask questions, because I'm telling you, that is like crucial what they say in class. I feel like a lot of times you go look at it in the book, and the book does have certain answers for what you're looking for, but sometimes your professors will emphasize certain things and you can't miss it during class. So one of the things that I did during class while I was paying attention is I recorded my lectures in Notability while I was taking notes, so that way I could just go back to the notes and I could hear the professors talking while I was like looking at my notes. Another thing that's really going to help you is keeping up with the material. After you go through the material in class, I would highly recommend that you look at it at home that week. I would not wait till the week of the exam, because there's no way you can actually like cram what you learn in med-surg. I feel like it's more of like repetition and like practicing like what they taught you. So I really feel like you have to keep up with the work, and I would not wait till last minute. I would definitely review what you went over during class that week. I would not let it go on any longer than that. You don't have to, like, if that doesn't really work with your schedule or anything, I would say at minimum just like skim your notes, or like sometimes on the drives I re-listen to lectures if I don't have time, or we have something called office hours. I listen to those too on my drive there or back, just kind of like keep it fresh in your memory somehow by doing something that week, so that it's not you're not learning everything last minute, because it's really hard to catch up. For my school, our professors gave us a list of objectives. So basically it was a list of things that we should know. It was kind of like questions that you could answer while you're going through the material. And those were things that you should focus on for the exams. I would highly recommend that you do those if your professor gives you those. But if they don't give you objectives and you're kind of on your own, I would really recommend that you go through your lectures and kind of like make up questions for certain things, like what are the complications of peritonitis, for example. When you answer those questions on your own, it really helps you to review the material, and you can go through all your notes and make up questions that way, and that kind of like makes up your study guide, and that really helped me. So for the third thing that I would recommend is I would highly recommend doing practice questions. So my professors actually give out practice questions. They love giving us practice questions for all the material every week that we go over. And those practice questions really helped you just kind of like focus on what they want you to know, and just kind of like what you need to be looking at more of if you don't understand it. Practice questions are a good way to test yourself and just kind of see what you know. So from there, I would know that I needed to concentrate on a certain section versus spending all my time on a section that I already knew. We also have the luxury of having Uworld at our school. So for Uworld, there's a ton of practice questions on there. You could create your own test using their test bank, or like some people I know have ATI, or whatever practice question like database that you guys have, that should work well. I would also recommend going out on your own. I actually went and got a book that I use, like I have like a priority book that I looked at questions from. I also looked at like questions from my actual textbook. So stuff like that, I would seek out your own questions, especially if you don't understand like the material. I would definitely do that. So I know that you've all heard about med-surg questions and how they're really hard because they're all similar and you have to pick the right answer. So one of the test tips that I would give is always remember your ABCs and Maslow's hierarchy of needs. So for the ABCs, airway, breathing, circulation, it really is very helpful when you're answering those questions that everything all seems the same. It took me a while to get this. I don't know why I kept forgetting the ABCs. I think it's because some of the answers seem so obvious that I'm like, that can't be the answer. But really, just if you don't know the answer, it's like when all else fails, ABCs. And then if ABCs is not working for you, Maslow's hierarchy of needs is also the next step that I usually use. Another tip is priority questions. You need to know how to answer these. And when I say priority questions, I mean the ones that are like, which one do you do first? So in these questions, you need to know that all of the answers are correct. For some reason, I did not understand that. I didn't know, and I'm looking at all of them and I'm like, oh my God, these all seem like things that I need to do so that the patient stays alive. But there's one that's most important. And when you're looking at these questions, you really want to look at kind of like what's most important, but also like another trick that I learned to answer these questions. It's a little morbid, but it's which one of these things am I gonna, like, which one is the one that if I don't pick, the patient will die? Like, that's what you need to look at the question like which one of these will kill the patient? And that usually is how I get the answer. If I'm like stumped and I can't figure it out, I'm like, okay, which one's going to kill the patient faster? And that usually helps. So here's a typical example of a question that you would see in med-surg. A client admitted to the hospital with a diagnosis of cirrhosis has massive ascites and difficulty breathing. The nurse performs which intervention as a priority measure to assist the client with breathing? A, repositions side to side every 2 hours. B, elevates the head of the bed 60 degrees. C, auscultates the lung fields about every 4 hours. Or D, encourages deep breathing exercises every 2 hours. So the answer to this one is B, elevates the head of the bed 60 degrees. So how I answered this question was basically all of the 4 answers, because it's a priority question, all 4 of the answers are correct. They're all things that you would do, but you're trying to find what's the priority. And if you reposition the person from side to side every 2 hours, that's necessary, but it's not really going to help them with the breathing in that moment. C, you can definitely auscultate the lung fields every 4 hours, but that, again, wouldn't help right away with helping the client to breathe. And then D, encouraging deep breathing exercises. That's a good preventative measure, but it's not necessarily gonna like help them in that moment. B is the only one that when you elevate the head of the bed, it's automatically gonna help the client to breathe better. So that would be the best answer. So another type of priority question is the priority questions that are like multi-patient questions. So those are the ones that it'll be like someone who came in from a car crash, someone who needs a blood transfusion, somebody who has appendicitis, and then maybe somebody who has asthma. And it will give you like 4 different scenarios, and they all seem like dire scenarios. Everybody seems like they're dying, and you're like, oh my God, like I want to help all of them. And then you kind of like use your best judgment, and then that's not really how to approach the question. And then it's wrong, and you're like, why did I get this wrong? And you can like never figure out how to really answer it. So that type of question, it's very important that you know how to answer the question, just because I feel like that's like scenarios that happen in real life. In these multi-patient scenario questions, there actually is a method to the madness. I'm going to show you right now. I'm going to give you an example, and we're going to go through it, and I'll show you how to answer it. Here's another typical question. This is a multi-patient priority question that you would see in med-surg. The nurse is caring for the following clients on a medical unit. Which client should the nurse assess first? 1, the client with acute glomerulonephritis who has oliguria and periorbital edema. 2, the client with benign prostatic hypertrophy who has blood oozing from the intravenous site. 3, the client with a renal calculi who is complaining of flank pain rated as a 5 on a scale of 1 to 10. Or 4, the client with a nephrotic syndrome who has proteinuria and hypoalbuminemia. The best way to approach this question is to look at what's expected versus not expected. For example, in number 1, the patient has oliguria and periorbital edema. Those are all expected findings for a patient with acute glomerulonephritis. In number 3, the patient has a renal calculi and a pain of 5 on a 1 to 10 scale. When someone has a renal calculi, which is like kidney stone, that's an expected finding because they're going to be in a lot of pain. In number 4, the client has nephrotic syndrome, and classic symptoms of nephrotic syndrome are proteinuria and hypoalbuminemia. In number 2, the client has benign prostatic hypertrophy, but they also have blood oozing from the intravenous site. This is not an expected finding. So because it's not an expected finding, that's the patient that you would want to see first. To reiterate, all of the other 3 options were symptoms that you would expect with the problems that these clients were having. So the next time that you look at one of these priority questions and they ask you which person should the nurse assess first, you always want to approach this question thinking which one of these patients has an unexpected finding, and that should be your answer. Med-Surg, believe it or not, it is not an easy class. This was Med-Surg 2 for me, and it was like really hard. Like it put me through the ringer. This semester, I felt like when I took that last exam, I felt like I got hit by a bus. I was like, I am so glad to leave this in the past and never think about it again. I mean, even though I'm definitely going to be thinking about it because this is the fundamentals for NCLEX and just for your nursing career. So it's actually really important, but it was so hard for me and a lot of other people. Like, it was a really hard class. I came into the semester thinking like, oh, like, you know, everybody kept saying this is going to be the hardest semester ever. And I was like, like, whatever, it'll be fine. I mean, it was fine, but they weren't lying. And yeah, I made it, but hopefully with the tips that I give you, you'll be set up for success and you'll kind of like get a heads up on what to expect. I feel like I just like walked into the fire and I didn't have anything to prepare me for it. So hopefully this helps you out. Thank you so much for watching my YouTube video, and let me know if you like the priority question examples that I gave. Let me know what you thought about the video. I would really appreciate your feedback and kind of like anything that you want to see or hear about, just about my nursing journey. Like, just let me know in the comments. And yeah, if you like this video, like, comment, and subscribe. Thank you so much for watching. Peace out.